All right, welcome back, everybody. This next hour, we're going to talk about conditioning the canine athlete. Again, I'm Alice Baker Meuten, and my email's not there, but it should be at the beginning of most of my lectures. If you have any questions, feel free to contact me, and I'd be happy to talk with you. So the basics of conditioning we're building towards this concept of fitness. So fitness is the ability to perform physical work, and this requires cardiorespiratory function, muscular strength, endurance, and flexibility. These two charts on the right are a couple that I pulled from online sites that show some of their interpretations of what goes into fitness for people. This company on the left here works on conditioning programs for dogs, and conditioning is considered the performance of these specific physical exercises that mentally prepare and physically prepare you for performance of a strenuous activity. In the dog, they consider, we'll talk very in depth about these, but flexibility, body awareness, cardiovascular, balance, and proprioception as the foundations. And then we build up to strengthening, advanced strengthening and endurance, building up to speed and quickness, and then last but not least, power. So, of course, I have to go into exercise physiology, but I'll make it brief. Unfortunately, I don't get the luxury of having it brief as I'm studying for sports medicine boards. But this is the basics of our exercise physiology, starting with skeletal muscle. So we'll go back to what is a muscle. So the myofiber is these functional units of skeletal muscle. And even smaller than that is the myofibril, and that's the actin and myosin protein filaments. So these guys are divided into sarcomeres. Between these Z discs is a sarcomere. And then we have actin extending from the Z discs and myosin extending from the M line. And they interdigitate with each other to create a muscle contraction. So the muscle contraction is caused by an action potential through all of these calcium channel, blah, 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 blah. Eventually cleaving an ATP causes the myosin to pull on the actin, causing a power stroke of the myofibril. So talking about different types of muscle, we've got the slow twitch muscle and the fast twitch muscle. The slow twitch muscles are the type 1 fibers, and these are our aerobic capacity muscles, so high oxidative capacity in these guys, and a high resistance to fatigue in this type 1 fiber. The fast twitch muscles are the type 2 fibers, and these are considered to be anaerobic metabolism. They have large amounts of glycolytic enzymes, so a limited aerobic capability, and they have low resistance to fatigue. So interestingly, the canine is type 2 fibers are very different than human type 2 fibers, as they have high oxidative capabilities in their type 2 fibers. And the new research actually shows that the muscles in the trunk and the limbs of the dogs lack purely glycolytic muscle fibers. Talking about respiration, this is also important in our exercise physiology. Ventilation is the mechanical movement of air into and out of the lungs, driven by the diaphragm and the central nervous system. Diffusion is the process by which these gas molecules, see, I'm sports medicine, I start saying muscles when I mean molecules. The diffusion is the process by which gas molecules move from the air to the blood, and then the blood to the air. So there are peripheral and central chemoreceptors in the body that detect changes in PO2, PCO2, and pH, and they regulate our ventilation. The energy used to maintain our ventilation during exercise is a large component of the total energy expenditure of exercise in the dog. Ambient temperatures can also affect respiration. There is some studies about dogs that are exercised persistently in the cold, and they can develop ski asthma. This is a concept in people where their airways constrict because they have been exercising in the cold for too long. Cardiovascular exercise physiology. This is the delivery of oxygen to the nutrients in the body, as well as the removal of waste. And one thing that we forget about often is temperature regulation. The cardiac output is the quantity of blood pumped into the aorta each minute, and it's determined by the product of the heart rate and the volume of the blood ejected per heartbeat, or the stroke volume. Our VO2 max is the greatest rate of oxygen uptake by the body during extreme dynamic exercise and is the best index for the intensity of aerobic exercises. It's a product of cardiac output and oxygen saturation. In the dog, increases in cardiac output are attributed mostly to increases in stroke volume, so up to 50 to 70% of their VO2 max. Further increases in cardiac output are due to increasing of the heart rate. In sled dogs, there's several studies on exercise physiology in sled dogs. This one showed that the heart rate can increase from 50 beats per minute to 300 beats per minute and can maintain between 250 and 300 beats per minute for a 60-minute run. In foxhounds, they found that conditioned dogs had an average of 14 beats per minute lower heart rate than unconditioned dogs, but they also approached 300 beats per minute on a treadmill at maximal exercise. So these are some really old studies. There's a lot of new stuff coming out about blood pressure and all that kind of stuff too. So talking about the goals of conditioning, we've got several goals. We can have a puppy that we just want to do exercises with. He may or may not become an athlete. He may just be a pet. And some of our goals with these puppies are just to help them help their bodies learn proprioception. Another aspect would be starting a new sport or starting a younger dog to a sport. So here we would be focusing on kind of the basics of strength and building up to more power strength and endurance as well, and depending on the sport. Another aspect would be conditioning an athlete for fitness or injury prevention. So we've got this guy in the bottom left-hand corner who's obviously very well muscled and very fit. So how can we make this dog better and help prevent injuries in that dog? And then, of course, why we're all here, rehabilitation and return to sport post-injury. And here we want to focus on flexibility and strength to prevent re-injury. These are a couple of websites that have really good resources for your clients and for you on conditioning programs. The Avidog actually has a program where your client or you can check in regularly with a veterinarian and a trainer to come up with conditioning plans as you go. So the components of conditioning, this will be the bulk of the lecture. We'll talk specifically about endurance, strength, core strength, proprioception, skill training, warm-ups and cool-downs, and flexibility. And then with that, we want to talk about our conditioning program in regards to the frequency, intensity, and duration of these exercises. This is another image I pulled from a website. They're on the left-hand side there, they have FINT, so fit, and that's their frequency, intensity, and time or duration. And this is kind of a training program for someone who wants to get more fit. All right, let's talk about endurance. So this is continuous aerobic exercise. That means trotting a dog for at least 20 minutes. This can be jogging with your dog at a continuous speed, so the dog can't be off leash and stopping and sniffing and catching up and all that kind of stuff. This is at a steady pace. Same bicycling next to you or working on a treadmill as well. They found that swimming, you only need about 5 minutes of continuous aerobic exercise to increase endurance, I guess, depending on how fit the dog is, but about 5 minutes. Then, and most activities that we do with our dogs are not endurance activities. If you think about it, they're more strength activities. So the only ones that I can really think of that require true endurance in dogs are typically mushing. And then sometimes some of these longer herding field trials and longer retriever type field trials as well. They need some endurance to make it through their long courses. So this is Purina has some specific exercise recommendations that your clients can do with their dogs. These are good little videos to have on hand for your clients.
If you're interested in running with your dog, it's important to start slowly. Intervals are often the key to success. We recommend slowly building up your dog's strength and endurance over a 10-week time period using run-walk intervals. Focus on 30-minute run walks 3 times a week. Make sure to take a day off after each day of running to allow your dog time to recover. To keep things simple and to ensure you're building up slowly, simply utilize a 1-minute running build-up each week. The first week, you and your dog will run for 1 minute and then walk for 1 minute. This is your interval. Continue until you reach 30 minutes. Continue to increase your run time by 1 minute each week, and by week 5, you and your dog should be running for 5 minutes and walking for 1 minute. Weeks 6 through 10, continue to increase your run time by 1 minute each week while decreasing your walk time. By week 10, you should now be running for a full 30 minutes. For full details on the interval training plan, check out the P5 Runners program.
Okay, so that's some ideas that you can have about endurance recommendations for your clients. Now we'll talk about strength training. This is a big topic with all kinds of directions that we can go. Strength is the ability of a muscle or muscle group to create tension and thus by resulting force. Strength is directly related to speed. And specificity is important in conditioning too, to make sure that we're working on the target muscle for strengthening. So if we look at this image on the left here, this is an example of our different types of muscle contractions. Hopefully we've talked about this all through our course. The isometric contraction is a muscle contraction, but it doesn't cause a change in joint or lengthening or shortening of the muscle. A concentric contraction causes a shortening of the muscle, and an eccentric contraction causes a lengthening of the muscle. So just a quick reminder on those principles. We also want to consider overload when we're doing strength training. So overload is a load that exceeds the metabolic capacity of the muscle, but must be achieved during exercise to make that muscle stronger. So this goes for endurance and strength training, that in order to make you stronger, you have to reach fatigue. This is a little picture of a fatigued dog down here. So some of my strength training ideas that I have for clients with their forelimbs would be wave, so waving in the air, or high five, where they actually reach out and touch your hand. And you can do that in different planes so that you're activating different types of muscles. Push-ups is probably one of my favorites. You can start with push-ups on the ground. So you send the dog into a bow and then stand, bow, stand. You can progress that by putting their back feet up on a step and doing bow, stand, push-ups. Or you can progress it by putting their front legs on a physio disc or fit bone kind of thing and doing push-ups on an unsteady surface. I really like sidestepping for forelimbs and hind limbs. So sidestepping on the forelimbs, that's going to help strengthen our adductors and abductors, and our stability muscles of the shoulders. So pecs, subscapularis, deltoids, all of that kind of stuff. Handstand is a very advanced one. A lot of agility clients and dog trainer types really like to teach this one, where the dog walks its back feet up a wall. This little dog's doing it up a tree, and that's handstand in a dog. Low tug, this guy over here is doing high tug, and you can see how he's really activating his back legs. But if you can envision a dog doing low tug, he's more pushing with his front legs than his back legs there. Hind limb strengthening, obviously stairs and hills, anything on an incline is going to build strength on the back legs. Sit to stands are great for glute strength. Backing up is really good for more hamstring type strengthening. Sit pretty to stand, so this is having a dog in its core workout of sit pretty and then taking it up to a standing position. So this is like doing squats in people. A lot of glute and quadricep action there. And then again, high tug, which we just talked about. Core strengthening. So this is a big topic in our world. I do see a lot of dogs that are really strong in their front end and really strong in their hind end, and it just feels like there's nothing in between. There's a lot of research on core strength in people, helping to prevent injury. I don't think we have that kind of data in dogs, but it is something to consider. The stronger you are in your core, the more ability, the more control you have over your body. So some of the exercises I consider to be core strengthening exercises are basic down to stands. So having the dog in a down and then with all 4 feet come up into a stand. So they don't go through a sit first, they go from down to stand. And that, I feel, engages the core really nicely. Balance disc work, obviously, is going to help with core stability. This is a Fit Paws instructor over here doing diagonal leg lifts on a physio ball. Obviously, that's a really progressed exercise. I start with diagonal leg lifts on the flat, then maybe diagonal leg lifts on a couple of low stability balls. It's very rare that I'll have a dog all the way up on a peanut doing diagonal leg lifts. So this would be kind of our physio ball work. You can just have a dog standing on a peanut like this and looking around in different directions, or doing sit to stands on the peanut, that kind of stuff. Crunches are a good one. They do know that just the action of side bending and flexion of the spine engages the core musculature. So doing minor crunches in dogs definitely helps core strength. Sit pretty. This is my little, name the breed before I give you the answer. Think about it. This is a Sussex Spaniel, and he's doing his sit pretty. It's usually much better than that. So this guy actually came to me with a forelimb weakness, and that he loves to just sit there and do his little bags, and his right forelimb was like this. So one of the exercises I actually had her do, because he would do this for several minutes at a time, is to just put a little TheraBand on this side to apply a little bit more pressure. And eventually he started making it more even. So lots of creative ideas that you can do with your rehab patients based on what their clients already know how to do and what the patient is already trained to do. Rolling over, I didn't mention that one, but this is a really good one for core strengthening as well. I made the mistake of not teaching my dog to roll over in both directions, so he's got kind of an imbalance and will only roll one way, so make sure you teach the dog to roll both directions. All right, whole body strengthening. These are things like crawling, crawling under cavaletti poles or just crawling on the ground. Doing cavalettis, you got to engage so many more muscles than just walking when you're doing cavaletti poles. Doing a jump series, this is something that I'll do a lot with my retriever clients because they know how to go out and back. You just put jump series between where they go out for their retrieve and back. Hiking is definitely a good strengthening exercise. Like I said, the things that we think are endurance exercises with our dogs are sometimes more strengthening exercises, and hiking is definitely one of those. If the dog is stopping and sniffing and coming back to you and pausing and things like that, that's a lot less endurance and a lot more strength. Backing up stairs is a good one. Probably more forelimb than hind limb, but definitely a lot of core engagement and a fair amount of hind end. This is my dog Storm. He was recovering, I think I mentioned in a previous lecture, from medial shoulder syndrome, and this is one of the exercises we were doing to help strengthen his cranial shoulder muscles, supraspinatus and biceps. And he will do anything for his ball. Let's see. Rolling a peanut. Oh, I wish I had that video of my little girl doing that. She's so good at it. So this is her on the right here. I had to teach her to dig. So in a previous lecture, I mentioned that she had that superficial digital flexor strain, and one of her exercises to strengthen those flexor muscles was to dig. And I think I may have shown you this video already, but this is how I teach dig. Yeah, so she pulls on her fit bone there with her paw. Tugging, we talked about that being forelimb and hind limb, but you can also think of that as being a whole body kind of exercise if you're doing it in a bunch of different planes and directions. So we also consider plyometrics to be whole body strengthening, so this would be explosive takeoffs and box jumps and things like that. Retrieving can be like chuck it. Everybody's clients do chuck it, and they think that's the best exercise for their dogs. It can be a good one, but it's often overdone. Playing with friends, obviously you see dogs running and playing amok. That's going to be a big whole body strengthener. And then running off leash, kind of like I was talking about with the hiking, where they're stopping and sniffing and coming back and forth to you. All right. Proprioception, this is a big one that we're teaching you in rehab. We think about this as being a lot of unsteady surface kind of work, so balance discs, physio balls, rocker boards, wobble boards. You can think outside the box a little bit and do ladder work, or what we call pickup sticks, where you just put a bunch of cavaletti poles on the ground and have the dog kind of navigate through this little obstacle course of cavaletti poles without touching them. Walking on a narrow plank, like a dog walk in agility, that's a good proprioceptive exercise. And then hind end awareness and targeting. This is a retriever client of mine. Again, I always try to find things that they're gonna do at home, and walking through a ladder was something easy that they could add to their fitness program for these dogs. And you can see this dog is really struggling to figure out this concept on the way out.
I wish it was wider, I think is what
Yeah.
I'm finding. Yeah.
And I think I have a later video that shows that on the way back, he had figured it out in one pass. Hind end awareness is a big one. A lot of your agility clients will be teaching this.
All right.
Let's see. So this is a hind end awareness exercise that I do with one of my dogs. He backs up and puts his feet on a fit bone, and he has to know exactly where, see how he has to think about where that fit bone is. He's really using a lot of proprioceptive awareness to place those back feet. And always a kitty photo bomb in all of my lectures. Skill training. This is definitely something that we need to progress to with all of our conditioning programs. So we get finished with rehabbing a patient, and if we want to get them to return to sport, we have to start adding in some skill training as well. So jumps, weave pulls, steep inclines and declines, explosive takeoffs. This concept of 2 on, 2 off, that's similar to that hind end awareness that I just showed you. This is an agility colloquialism, I guess. They could say 2-0-2-0, so that means 2 on, 2 off. And what that translates to is that the dog's back 2 feet are planted on a contact, and their front 2 feet are on the ground. So the contact could be a mat, it could be a step. In my dog, it's that fit bone, but the goal is to build up to the contact obstacles in agility. So we can look at a few videos here. This is that one I showed you in a previous lecture. This dog is training jumps and fast turns. So he has to do this really rapid turn to turn back on the jump. See that? This dog we were rehabbing for a flexor carpi ulnaris injury, and he's back to sport and doing great. And this is one of the videos that we were analyzing right before he went back to competition. And you can actually see as he does one of these jumps how much flexion he has to put in his carpi and tarsi. Here we go. See how that carpus is all the way on the ground? Same thing here, those tarsi hit the ground as he takes off. And then when he lands, if I were a better practitioner, I would have done a slow motion video instead of just adapting a regular video. But you can see how his carpi are extremely extended all the way to the ground right there. Again, that's normal in dogs. For some reason, some dogs get injuries from it and other dogs don't. He unfortunately did. This is that box jumping video. Again, a retriever client of mine. This is something, a conditioning program that they can easily do on their property or when they go anywhere to do training. They just have a little box that they can use to warm up their dogs and get them ready. All right. Another retriever exercise that we can do is have them send their dog what they call wagon wheels. So they go out for a retrieve in one direction and then that direction. So like 11 o'clock, 9 o'clock, 7 o'clock, all the way around the wagon wheel. And this is it's good for explosive takeoffs, fast declines, decelerations, and you can even add jumps through these too. Hurdles. This is kind of a full conditioning program for this guide dog. We were rehabbing a little iliopsoas strain in him. So we were doing a series of cavalettis. These are 2-on, 2-off reaches that I do. So an eccentric contraction of the iliopsoas muscle. And then again, these 2-on, 2-off reaches, but on a Bosu ball. So lots of good stuff we can do for our patients with full body exercises and skill training. All right, moving on to warm-ups and cool-downs. So we know in people scientifically that warm-ups and cool-downs are good for the body. We don't have very much data in the dog. But since they're mammals as well, we assume that warm-ups and cool-downs are ideal to be practicing with them as well. So the purpose of the warm-up is to slightly increase the body temperature to encourage vasodilation and muscle perfusion, thus increasing oxygen and nutrient delivery to the tissues. We do know that warm muscles are harder to injure than cold muscles. And the muscle tendon junction is more able to stretch when it's warm, and warm-ups actually increase the speed of contraction and relaxation of muscles as well. Warm-ups can be divided into two different categories. There are passive warm-ups and active warm-ups. So a passive warm-up we would be applying something to the muscles rather than the muscles going through an action or an activity to warm themselves up. So the passive warm-up would be massage or the application of heat. A lot of agility clients use what's called a back-on-track jacket. So it's this magnetic reflection jacket that helps warm up and cool down muscles. In active warm-ups, it's a pretty basic kind of just jogging around, walking, trotting. It'd be ideal to go through some of the skills that you're getting ready to do in your activity. So improving your coordination for those skills that you're about to be performing. In some venues, you're not allowed to practice before you do the competition. So in herding specifically, a lot of our venues, we just take the dog out and they do their course. And a lot of people don't think about doing those warm-up activities before their dog runs. And their dog, right from the start line, has to go into this explosive, fast motion out to gather up the sheep or livestock of whatever kind. So we think that having those muscles warmed up ahead of time, maybe even a little arena setting where they can work around with some sheep, could be helpful to the dog's warm-up. So ideally the warm-up would be enough time and enough intensity to not cause fatigue, but to get these muscles prepared for activity. It's really easy to overdo a warm-up. I've had clients say that they do 20 or 30 minutes of warm-up exercises before they run their dog on a 2-minute agility course. So education about what the goal is would be helpful in those situations. Cool downs. This is similar principle, just kind of walking the dog around, progressively decreasing the amount of intensity that they're doing. So you just lower the intensity of the exercise by about between 65 to 30% of the oxygen consumption capacity of the muscles. So progressively starting with like 65% of what they were doing, down to 50% of what they were doing, down to 40, 30, down to when they are cool. This encourages the blood to continue to circulate through those muscles that were just used so heavily to help remove waste products, and like the principle of thermoregulation, helping to cool down and dissipate the heat from the muscles. The time to complete recovery really varies on the type of exercise, the type of dog, the fitness level, all that kind of stuff, but generally 10 to 20 minutes is recommended. And then stretching. Do we stretch during warm-ups? Do we stretch during cool-downs? We really don't know. In humans, there was a study a few years back that showed that stretching before activity doesn't do much to help your performance, but stretching after activity does. So do we know if it's the same in dogs? I really don't know. I usually add in some what I call active stretching for my warm-ups for dogs, so having the dog do some stretches itself. I have 3 that I like to do for my patients. I call them up dogs, so front feet up on a step or a chair and reaching up to get the hip flexors stretched and the front, the core and the front of the chest and shoulders. And then down dog, which is taking the dog into a bow, getting spinal extension, glutes and hamstring stretch, that kind of stuff. And then side bending stretch, getting the lateral abs and hypaxials and epaxials. So those would be just active stretches that I would do as part of the warm-up. And then in the cool down, you can do those same activities. If you are comfortable with doing passive stretches, or if your client is comfortable doing passive stretches, this is where you manually apply a stretch to a muscle. There is some theory that you have more potential to damage muscles if you provide a manual stretch for these muscles. Oh, here we go, talking about flexibility. Back to doing this up dog kind of stretch, down dog. Here we go. This guy's doing up dog, so really getting a stretch in that hip flexor, front of the shoulders, abs. This dog's doing down dog, so you can see how extended his stifles are, getting a nice hamstring stretch there. If you look at the forelimbs, he's getting a tricep stretch, lats, all those kinds of muscles. And then here's our little side bending, getting our spinalis system muscle stretches. And over here is a picture of me doing manual stretching on a dog. This is kind of working on lats flexibility. We can take it into triceps by flexing the elbow. With caution, you can do passive stretches if the dog is able and willing to let you do it. I would encourage those of you doing passive stretches to make sure the muscles are warmed up before you do passive stretching. The benefit of passive stretching is that you know which muscle you're stretching. If I have a dog doing his up dog, I assume that he's stretching his hip flexors. I don't know that because I am not that muscle. We don't have an electromyogram on that muscle. But with the manual stretching, you take your insertion further from your origin. And that provides a stretch to the muscle. All right. So talking about sports physicals, if you're setting yourself up as a rehab practitioner or a canine athlete practitioner, you'll probably have clients coming to you for sports physicals. This includes several parameters that you can measure, starting out with a basic physical exam. So evaluating the dog's structure based on their conformation. Are they long-backed? Are they straight through the stifle? Are they straight through the shoulder? Things like that. evaluating their muscle tone, so their musculature. We can check their tone. We can check the bulk of the muscle. Is there imbalance between hamstrings and glutes? Is there imbalance from right to left? That kind of stuff. Body condition score, always we need to be doing this with our athletic dogs. I feel like I saw a paper recently that showed that overweight dogs were more prone to having conditioning problems. So our body condition score, I use the 9-point scale. A lot of you probably use the 5-point scale. To me, an ideal athlete would be more of a 4 rather than a 5, but most of our scoring systems say that 4 or 5 is ideal. But as far as an athlete, I think we need to be leaning more towards the 4 side. One of my mentors, Dr. Chris Zink, does a body fat assessment. I encourage you to take her course and see about all of the cool things she's coming up with. But we're finding that just doing a general body condition score doesn't really tell us how much body fat that dog has, because we've all seen the dogs that are more than a 9 out of 9. Those of you doing medical manipulation, we can do our medical manipulation exams, so checking for hypomobility in different areas of the spine and the limbs. We can do a functional exam. This is similar to my stretch tests that I just showed you. I'll have a dog do those up dog, down dog, side bending kind of stretches, and this is functionally assessing whether or not they can do those things. We can also take them through just general obedience kind of things. So can they sit? Do they just plop into a sit? Do they have to extend their stifles when they go into a sit? Do they sit way tucked back on their rump instead of on their ischial tuberosities, that kind of stuff. Same thing with lying down. So going from a sit to a lying down, is it just like horribly painful for them to get there? Do they just collapse because they don't have the eccentric control of the muscles to get down? Can they not go down because their elbows won't move at all? So these are just functional exams that you can kind of put together on your own. I can talk you through what I do, but those are some of the principles that I like to do. And another cool thing about doing these functional exam tests is you can do all of this before you even put your hands on the dog. So the dog's just getting comfortable being around you, being in the room, before you even put your hands on them. Gait analysis, always at least do a subjective gait analysis for these guys. So are out and back, watching side to side at the walk and the trot, maybe doing some circles, maybe even watching the dog go through some of the skills that they'll be doing in their sport. And then objective gait analysis, if you've got access to these TechScan and GaitRight mats, if you've got access to the kinematics and kinetic systems, even better. But even if we don't have access to some of the objective systems, the subjective data is better than none. We do want to do minimum databases on our canine athletes too, checking CBC. Is there a mild anemia? Is there thrombocytopenia? Wow, yeah, I'm definitely a sports medicine vet now. Chemistries, checking for elevated liver enzymes, kidney disease, things like that. Electrolyte abnormalities are important to look at with our athletes too. Checking T4, these hypothyroid dogs. I think there's a sled dog study that showed that lower T4s affected performance. Checking a urinalysis too for protein losing nephropathies, things like that is helpful. And then we want to talk through nutrition and supplements that the clients are using for their dogs. So making sure they're on an adequate nutrition plane. What supplements are they using? Is it too much? Is it not scientifically supported? All of that kind of stuff. Radiographs are great information too if you can get your clients to do just a general hip and elbow kind of screening. I'm trying to push people to do shoulders too, especially in border collies. We see a lot more OCD lesions than or what we used to think. And then the different types of hip x-rays, you can do just your general OFA style hip x-ray, so the extended hip view. Or you can go through the PIN-HIP program. So the PIN-HIP program actually tests for distraction of the femoral head, so how much laxity there is in the coxofemoral joint. And this is great for young dogs before there is evidence of hip dysplasia to know if these guys are at risk of developing osteoarthritis of their hips and whether or not there are interventions that need to be done early on. I think I had a video of a border collie puppy. This dog actually came to me at 1.5 years for intermittent lameness on the left hind leg. And we did x-rays, and it was very obvious she had hip dysplasia, mostly in the left leg, less so in the right. And come to find out, she had x-rays done on her as a 20-week-old puppy for an unrelated event, and just kind of a screening to see what her hips looked like at that time. And they looked perfect then, but if we had thought about it ahead of time and did a PIN-HIP program instead, then maybe we would have caught the hip dysplasia earlier and gotten her on a better intervention. So talking about conditioning programs, we want to talk about our frequency, intensity, and duration. Make sure that we have that whole triad figured out. If we have too much frequency, so we're doing something every day of the week, sometimes that's not ideal. If we have too much intensity, we can be going past overload into fatigue. Are we getting to the point where it's not good for the tissue? Duration, is it too short? Is it too long? Making sure we're right in that optimal training zone. And then we definitely need to follow the principles of specificity and overload. Are we specifically targeting the muscles that we want to target? And are we getting those muscles to overload to build strength in them by reaching fatigue? In my conditioning programs, I think I hinted on that through this lecture. I try to make them sport-specific and client-specific. So does it translate to their sport, and will the client be able to do it at home, basically? So I use different obstacles and different training methods that they have on hand or that they already know how to do. So let's take, for example, using rapid acceleration and deceleration. So it requires plyometrics and eccentric control of the muscles. So in agility, I would teach them to do 2-on, 2-off decelerations here. I would also teach them to do box jumps because they're doing a lot of jumping in agility. In the retrievers, I hinted at that we do these log hurdles, and another good one for plyometrics is entering and exiting the water rapidly. In herding, we would use a lot of flank commands. So in herding, we have dogs do these big flanks, so outruns or swooping around the livestock. So you would give a flank command one way and then stop them and go the other way and kind of vary it up on how far they go, for how long, and how quickly they have to stop and turn the other direction, that kind of stuff. In flyball, we would do box jumps too, because they have to build that momentum of pushing off to build strength and speed. And same thing with turning at the box. The box jump will help with that. So I think they actually have. Let me see how much time I have. Yeah, here's a video. This is that Purina type video again, for strengthening using box jumps.
Box jumping is a great activity for strength training with your dog. It will help in diving dog, flying disc, and agility, especially with the pause table. I use a plastic box and I cover it with a yoga mat to prevent the dog from slipping, which may discourage him from this activity. Start with the dog on one end of the box. Ask him to come up on the box and jump off. Remember to use positive reinforcement and lots of praise. Okay, come on up. Good boy. Off. One more, buddy. Come on up. Good boy. Off. That's a good boy. Remember to keep your sessions short. And as you build endurance, you can make your sessions longer.
So you get the idea there, and again, another good resource for your clients. Another thing to think about when you're building conditioning programs is your appropriate progression. I think I hinted at this a little bit already too. So we want to have phases of progression through difficulty. So starting with a post-op injury, we would start pretty low in our strength training and then hopefully get to a more progressive skill training and return to sport kind of training. If you go too rapid with your progression, it can lead to overtraining, and if you start too slowly with your conditioning, it can actually lead to deconditioning. So I encourage you guys all to kind of play around with building your own conditioning programs. I'm happy to support you if you've got ideas and questions. We can talk about it through email or in person. Again, I gave you some resources for websites that can help you build conditioning programs as well. And I look forward to hearing from you. Thanks very much. Bye.